Okay, I think we are ready to get going. Welcome. We have a little less than half of chapter 24 to talk about. I'm hoping deep down, I'm hoping that we'll be able to jump into 25 as well. We should be able to. But I know I've got a handful of worms in here that I'm just like, oh man, I could talk for a whole week about these. Okay, that's all right. So we left off a bit of the way into some viral infections, and I left off with hepatitis. We haven't talked about this slide. I know this was right, our ending point on Monday. There are numerous types of hepatitis viruses. They are different, but ultimately we think about their impact to the liver and hence hepatitis. All sorts of different signs and symptoms. Some of these we think about the potential for like maybe foodborne illness, hepatitis A, a good one when we think about that sort of a fecal oral transmission. And then we think about some that are transmitted through blood. So it kind of depends on the circumstances as far as how you might contract it. And some others that potentially enhance the activity as well. We'll hit a little of that. So hepatitis, it ultimately is inflammation of the liver, and there are numerous potentials. These handful of viral culprits are one of many that potentially can initiate this. So with that, there are a handful of potentials besides the inflamed liver. We can see jaundice, and we can see some of the tinted skin and the sclera, which I assume this patient would also have it if we were to see their eyes. But as we see this one, you can definitely recognize the yellowing of the sclera. So that might be the first hint that there's potential issues when you recognize some jaundice. All right. There are also some potential issues with this when we may think about, individuals living together may not recognize their significant other developing some of this because they see them all the time and don't really recognize. And maybe it's when someone else comes over to visit and they're like, whoa, what's going on? So it seems like it should be something that's like a big red flag, there's problems, but it also kind of depends on circumstances. All right. My mother had some issues and my dad didn't recognize any sort of jaundice going on. And when we went and paid a visit, I was just like, good hell, Mom, what's going on? Right. So not being there the whole time definitely lends to some potentials with different eyes seeing something. So that's just my own little two cents with that, because he sees her all the time. He's like, I didn't even realize, right? So definitely lots of different potentials that may stimulate some of these problems. And as we're hitting the hepatitis, that's really what we're thinking about initially with this. But again, there are other culprits that can cause problems, right? And really kind of just depends on some of these circumstances. So hepatitis A, oftentimes we think of this as maybe like going out to eat, and then you hear, oh, someone that worked there, was tested positive for hepatitis, and you should get checked if you happened to be there. Usually they say something to those effects. Oftentimes we see asymptomatic individuals, and that sets the stage for some of these potential issues where you may not know, right? Infection may be mild to self-limiting, and that also lends to other potential issues. But it can lend to some serious consequences. So food and water with our first one. Hepatitis B, we think about bodily fluids, blood, semen, saliva, IV drug use sets the stage for the potential to spread this, along with sexual contact. Healthcare workers dealing with infected patients also set themselves at risk of potentially contracting just by coming maybe in contact with their fluids, or accidental needle sticks also set the stage for worry with that. There are vaccines recommended for infants and high-risk adults. Healthcare workers, definitely we think about vaccination against hepatitis B. So the potential with this to progress to cirrhosis, hardening, deposits within the liver, and liver failure or potential cancer of the liver are all possibilities. Liver cancer also a potential with hepatitis C. It's another one, similar transfusion as hepatitis B, and really kind of depends on some of the situations with this. Oftentimes asymptomatic, with a good chunk of individuals being chronic carriers, not recognizing issues. No vaccine currently available, but there are some antiviral treatments that ultimately can rid the individual of hepatitis C. Oops, wrong button. Okay, hepatitis D. It's similar to hepatitis B, but it's self-limiting, couple of weeks. There are some potentials with chronic infections. And really the kicker with D is for it to really do its job, the individual has to also be infected with hepatitis B. That's when we see the ill effects. But otherwise, we don't really see any sorts of situations if hepatitis B isn't on the table. So vaccine against B protects against D, because if you can't get B, D isn't going to do its job, all right, which is kind of crazy. Hepatitis E is more like hepatitis A, fecal oral transmission. Food and drink set the stage for those potentials, and areas where sanitation is lacking enhances the potentials with that. So shifting over to some parasites, Cryptosporidium is an organism that sets the stage for kind of a good amount of diarrheal disease. It's something that is important when we think about immunocompromised individuals and other situations as well. But that definitely lends to some potentials. Cyclospora catiensis, these guys we can see here fluorescing, autofluorescing under UV light. So no specialized stain, just shining a UV light or black light. They kind of glow in the dark, if you will. These, we will get to a table in a second. These are responsible for some pretty serious diarrheal disease. And we think about contaminated food or water, but oftentimes foodstuffs may be contaminated with it that set the stage for issues. So as far as the initial bit with parasites, we oftentimes separate them and think about the protozoal diseases, and then we think about the helminth or all of the worm diseases. So initially with our parasites, the protists, all right? We saw Cyclospora and our Cryptosporidium. We saw both of these guys in those images. We didn't show you Entamoeba histolytica, amoebic dysentery, and we also didn't show any Giardia in those images, but I'm pretty sure we've seen a picture of Giardia before. It's a little flagellate. So, couple of different potentials, all right, with who we may be having, from flagellates to amoeboid forms, and these, I think our crypto was a flagellate as well. All right, that matters not, all right. All of these, we think about, you know, fecal oral situation, some sort of contamination. Often it is a cyst that, when we think about parasites, a cyst or an egg that might be infective. And in this case, with our amoeba, it's a cyst of that parasite that gets ingested. Once it's ingested, it converts, it basically sheds that shell, if you will, and starts growing as the trophozoite form, the amoeboid form. Feeding on contents within the lumen of the intestine, but also destroying tissues and feeding on cellular contents, potentially perforating the bowel, and then moving into other organs and causing issues. Oftentimes with amoebic dysentery, if it does break through the intestines, the first organ that it targets is the liver. There is extensive damage that's potential to the liver. And it may, after causing numerous abscesses, progress further, perforating through the diaphragm and making its way into the lungs, causing almost always a fatal infection in those circumstances. Typically, we think about amoebic dysentery residing within the intestines and not truly making its way further, but if it does, serious complications oftentimes present, all right, as we see abscess of the liver and other stuff, all right. So can be from mild to pretty severe dysentery and colitis, and as I said, abscesses and potential for other issues with that. Oftentimes, we think about potentially traveling to areas where sanitation is maybe lacking, but we do see incidents of amoebic dysentery, typically more southerly states harboring some of this, but usually elsewhere sets the stage. So our cryptosporidium, watery diarrhea, nausea, vomiting, cramps, and fever, contact with feces from all sorts of different animals sets the stage to some potentials for this. And oftentimes we think about swimming pools for situations. Little kids oftentimes are pretty good for harboring all sorts of things. And if a little kid's got some diarrheal disease, first off, you shouldn't be taking them swimming, all right? That should be the first thing, but it happens, all right? And in turn, you can contract it that way. So contaminated water at the swimming pool and getting water in your mouth, oftentimes also flipping it back to little kids, because typically as adults, you're not like, sweet, I think I'll drink some swimming pool water, right? But I hope at least, right? And if not, well, now you just learned something, right? Don't drink the pool water, right? But little kids, maybe that's not the case, right? So the cyclosporiasis, Cyclospora catiensis, this causes some pretty serious issues. Explosive diarrhea, you know it's bad, right? Fever and nausea, vomiting and cramps, loss of appetite, fatigue and bloating. We think about contaminated food and water. There are really with the Cyclospora, something that we think of as on our radar, kind of as a new or an emerging pathogen. It's something that's likely plagued us for quite some time, but really to recognize this is the culprit, pretty new to recognize. Early 1990s, there was an outbreak of this with a handful of doctors in Southern California, anesthesiologists. They were all at this conference. Multiple hospitals, they all brought them together and they're meeting, they're talking. Pharmaceutical company probably is the one putting this thing on, trying to get people to mingle. And they have a big banquet, a bunch of people get sick. All of these doctors calling in sick raises some concerns. They're like, what's up, right? There must be some sort of foodborne illness going on to wipe all of these people out. And they do some epidemiology trying to trace foodstuffs, and they figured it out that the culprit were some raspberries that were served on some desserts, and everybody that consumed the dessert contracted the illness. Kind of interesting to think epidemiology and how really that plays. It was truly a person working in the lab that figured out how to figure out who's causing this. She developed a procedure to truly detect the cyclospora. They were able to visualize it under the microscope, see this thing, and in turn figure out how to treat based off of recognizing what they were dealing with, this parasite. Pretty cool. All right. So the raspberries ultimately contaminated with some fecal material that sets the stage for issues. Produce like that, typically picked, packed up, and shipped off, never rinsed, never washed, because those little berries, once you wash them, start to break down. So people oftentimes buy them at the supermarket, open up the package, and just start eating them. That also sets the stage for some potential issues, all right, if they have been potentially contaminated, all right? Other things can also set the stage for that, but typically we think about things like raspberries and other crops, like maybe basil or something else that may not really be dealt with anyway, except for just put into something, right? And not, cooked or whatever. That sets the stage for some issues. Giardia, holy cow, I could talk about it for a long time, but I won't. Giardia is a super common parasitic infection. It is something in the United States that's probably our most common protozoal infection. It's something that really persists all over the place. Thinking outdoor hiking, camping sort of situations where you're coming in contact with water and maybe consuming that water without sterilizing it or boiling it. It sets the stage for you to become infected. So oftentimes we think about water, but it could be foodstuff or fomites, so inanimate objects that have come in contact with typically water that has these cysts within it, all right? We get infected with Giardia by ingesting Giardia cysts, and then it exists within the intestines and starts growing as the trophozoite or the flagellate form, and it takes up the bulk of the space and causes some serious issues. You get some diarrhea, nausea, stomach cramps, gas, greasy stool, dehydration can be pretty severe, and you can get malabsorption syndrome as well. Lots of potential issues, all right? Typically, when we think about like a hiking or camping situation where you've ingested this water, it takes almost a month for those parasites to take hold and start replicating and really take up the space before you see the ill effects. So oftentimes when you start getting your symptoms of Giardia, the last thing you're thinking about was the camping trip a month ago or better. You're not thinking about that, right? But ultimately, that's really where it came from. And there are numerous other potentials where Giardia may make its way into your household. If you've got a dog, you oftentimes, and you go camping, you oftentimes would take your dog camping with you. And if you don't, you're probably just a butthole, right? That's what your dog thinks. He's like, why wouldn't you take me camping, right? I love that. Dogs get Giardia too. And in turn, a dog can bring that Giardia into the house. The water dish could be contaminated. And if you've got little kids, they tend to get into the water bowl and mess around and potentially put their fingers in their mouths, and then they contract Giardia. And maybe you went camping and the 2-year-old didn't go, right? 2-year-old stayed at grandma's house, right? And now they end up developing Giardia, and they never went camping. It was Fido that brought it to the water dish, right? Lots of different possibilities with that. If I would have truly been on my game this morning before I left my office, I would have grabbed my worm and brought it down for some show and tell. It's not my own worm, but it's my worm. I have an Ascaris. Ascaris lumbricoides is a type of roundworm. It's a nematode. The one I've got's a little over a foot long, right? Probably, you know, about that long. Pretty good size, pretty large roundworms, all right? This is something, you know, when I look at this intestine full of worms, and I see this handful of worms right here, I think this has got to be like the true definition of a buttload of worms, right? That is a massive amount of worms, right? And in turn, it can be super serious. It can cause fatal blockage of the intestine, definitely issues, all right? We get infected with the Ascaris lumbricoides by ingesting these eggs, which in turn hatch out and we get the adult stage of the worm. They do not proliferate within our body. So as we see this intestine full of worms, it's the result of ingesting handfuls upon handfuls of those eggs to get yourself, you know, 100 worms or however many worms we've got going on in this handful right here, right? Lots of eggs, all right? And that in turn sets the stage for some individuals to truly have a serious amount of worms, a high worm burden, we would say, and symptoms in these individuals would be serious, all right? For sure. Hookworms, there's so many different details with hookworms. So much stuff. Hookworms, there are a number of different types of hookworm parasites. There are 2 of them that infect people, and we serve as a definitive host where we get the adult stage of the worm within our body, all right? These are also a roundworm, so a nematode, separate sexes, they reproduce and release their eggs, all right? So with that, there are some other hookworms where we're the wrong host. They may get into us, but they truly can't migrate and take up residence where they really want to be. So we think about these guys as kind of a wandering worm. It causes what we call cutaneous larval migrans or a creeping eruption. They stay localized under the skin. We get an immune response and it's all red and inflamed, swollen up as a result of the metabolites from that juvenile worm trying to bore deeper and make its way in, but it can't, all right? So this, wrong parasite, all right? The others would bore through our skin. The egg is released out into the environment. It hatches. The larval stage is growing and feeding on bacteria, typically fecal bacteria. It eats that stuff, and then we happen upon it, and the larva penetrates through our skin. So walking around barefoot sets the stage to contract hookworm. It penetrates through your skin, makes its way into your circulation, travels up into the lungs, breaks out, gets hacked up in the sputum, swallowed down to the intestines, and then it takes up residence where it wants to be. That is a pretty terrifying migration through the body for that worm to bore through the skin and then find its way into the intestines. And oftentimes parasites do some crazy stuff to get where they need to be, all right? So hookworms truly vary depending upon those getting us, vary as far as severity. Typically a handful or so of these worms, you may not recognize any ill effects whatsoever. When we start getting upwards of maybe a couple dozen, you might start seeing ill effects, and then compounded more, maybe get to 100 or better, and we definitely start seeing serious issues, all right? So truly kind of dosage dependent on how many worms you've got going on that sets the stage to some of these potential issues, all right? I'm going to take one quick sidebar and tell you a little detail about this because I think it's super cool. It's also a little, maybe a little bit disturbing, all right? We have talked about the Clostridium difficile, those super infections and antimicrobial resistance, and sometimes people with a serious Clostridium difficile infection will get a fecal transplant. And it gives them good bacteria back into their intestine to help take over that stuff. We've talked about some of that, all right? And that may potentially be something that might seem a little disturbing as well, right? So here's another story that I truly think is pretty interesting. There are all sorts of different immune reactions, allergic reactions, autoimmune conditions. And in the United States, we see this considerably more than if we were to look at other countries that are still developing, where maybe hygiene isn't as high on the list. And they see more infectious disease and definitely see more parasitic infections, all right? Countries where there are lots of gastrointestinal parasites, we don't see those populations exhibiting lots of allergic reactions, all right? Just pretty much doesn't happen, all right? And that brings up this idea of this hygiene hypothesis. If you are living in a pretty sterile environment, your potential, although it seems good to be clean, right? The potential for your body to be idle and not really dealing with things as frequently as it might have once been sets the stage for maybe it to turn on ourselves and stimulate different types of allergies or autoimmunities when an immune response that's constantly thinking about like a parasite doesn't have time to say, oh, I'm going to target my own stuff. If it thinks anything like that, that's beside the point, all right? So there are evidences of individuals that have cured or really treated themselves, their symptoms of these allergic or autoimmune conditions by deliberately infecting themselves with worms. Hookworms, definitely one of them, but there are some other worms as well. And they truly see promise, all right? You can quickly Google hookworm therapy. There is an individual, he lives in England. He has infected himself. He has cured himself of his severe allergies, and he in turn harvests and will supply you with some hookworms if you are in need, all right? I think that is really cool, all right? And it brings up this idea, you know, if you had to, right? If it was the matter of, I need to do a fecal transplant or I need to infect myself with these hookworms, which would you do, right? Would you do both? Would you do neither, right? You're just like, that's flat out disgusting, right? So the thought of maybe letting yourself get infected by these worms, letting them crawl through your skin and infect you is disturbing. There are some other evidences of these worms secreting substances on the outside that may stimulate immune responses. And in some instances, parasites shift what they are presenting, and that may make it so they can survive on. But if we think about just stimulating it with those substances, potentially we could harvest the proteins that stimulate that and give you a pill that only has that substance and not the worm. And maybe then people would be more on board. They'd be like, all right, I'll take that. I'm not getting infected, right? But it still gives me similar potentials. I think that's interesting. All right, enough of those hookworms. Pinworms, holy cow, another one that I'm just like, well, that's fun for the whole family, all right? Pinworms are a highly contagious worm, definitely something that we think about more for little kids, nursery, daycare sort of situation, sets the stage for them maybe to contract it. These eggs, this image over here, very small eggs that get spread all over a contaminated situation. Those eggs get ingested, and now you've got these worms. They are very small, kind of pin shaped, hence the name pinworm. And in turn, the female, bit longer than the male. Typically, when it comes to the nematodes, females are usually a bit larger than the males because females are pumping out mass quantities of eggs. In this case, the male finds the female, they reproduce, he dies shortly after copulation. She gets all of her eggs ready to go, migrates toward the anus, protrudes through, lays her eggs, which is what we're looking at right here. And then shortly after she's deposited the eggs, she's going to die as well. All right. So the eggs truly get all over the place. This a cellophane tape or a Scotch tape prep where you can take a piece of tape, stick it on the anus, and if the eggs have been deposited, you will see them stuck on the tape when you look at them through the microscope. You also have the potential to maybe see the worm protruding through if you're going to put the tape down there. My first thought is, oh, what do you do? Stick it on the tape, pull it out, right? Run away, put your kid outside, and you're like, you live out here now, right? I don't know what you would do. Crazy, all right? And in turn, you have to decontaminate the house from the top to the bottom. All of the carpet and upholstery and all of the bedding and clothing and stuffed animals and everything. And when you think you cleaned it all, you probably didn't, and you got to start over. It develops in the adult a condition that we call pinworm psychoses. If you didn't have OCD, you got it now, all right? It freaks you out, all right? And that, I think, is a little bit disturbing as well. The doctor won't really do too much. I mean, they can give you some treatment, but the odds are it's probably going to come back, and the infection that you get with it, pretty much not much of a big deal. It's not a fatal infection. It may cause a little bit of restlessness, nervousness, irritability in a little kid, things like that, maybe night terrors. That's maybe a little more of a concern. But some of that stuff, you're just like, well, that's being a little irritated kid. That's normal, right? You would think, right? That happens, right? It's a little more pronounced than that. And then you're like, wait a minute, maybe you have worms, right? That's probably not something you think, but you ought to. Whipworm, this is a more disturbing image right here. Trichuris trichura is the whipworm because it kind of looks like a whip. This is the egg. And in turn, the adult worm living within the colon has the potential to cause rectal prolapse. This is definitely more common in little kids to see this happening. It also can cause stunted growth, finger clubbing, so your fingers are very like stumpy and widened at the tips, all sorts of issues that can result with whipworm infection. Trichinella spiralis, this is another roundworm. This is from pork or some similar ones, but typically pork. Bear meat is also a potential, and some other possibilities. Hyena, if we're thinking Africa, can harbor this as well. But I also stop and wonder, would you eat a hyena? Maybe, right? All right. Would you eat a bear? Right? Maybe, all right. I tried bear meat one time and I was like, yeah, not a fan, right? All right. So truly kind of depends. These guys, an interesting tidbit with Trichinella spiralis. Trichinella can make its way into the musculature. And so in this case, not only could we serve as the definitive host, the adult stage of the worm, with them in our intestines pumping out eggs, but we could also ingest those eggs. And now we're like the pig or the bear or the hyena, all right? And those eggs, once they've been ingested, the larva will make its way into the musculature. They take that muscle cell and convert it. It's no longer a muscle cell. Now it's a little nursery for this developing larva. It redirects blood supply, causes angiogenesis, so it feeds itself, nourishes itself. And then that's what we're looking at here is this musculature with what we would call nurse cells. It's the larval stage encysted within these muscles. And consuming that poorly cooked meat sets the stage for us to become infected, all right? So the pork roundworm, we can serve as a definitive and an intermediary host. And the pork tapeworm also serves the same idea where we can be a definitive and intermediary host where the ingestion of those eggs causes some cysts to form, not nurse cells, but similar idea within the musculature, and that ultimately would be infected, all right? Thinking this happening in us, ultimately, my gut says that's a dead end for this parasite because, well, most likely we're not going to be consumed by anything, right? And if we are, I guess deep down, we hope that, you know, maybe they cook us up first, right? There you go, right? You know, Jeffrey Dahmer, you got to cook them, right? I don't know if he cooked them or not. I didn't watch the show, all right? My wife did, and I'm like, I'm not watching that. I can't watch that, right? She likes that stuff, not me, right? Anybody? You haven't seen, no? You've watched some. Did he cook them? You think so? Okay. Why not, right? Nice stew. That's gross. All right. So here's some tapeworms. And this one that we're looking at is the pork tapeworm. It's got some hooks up here on the scolex. The beef tapeworm lacks this, but it looks similar otherwise, all right? So Taenia solium is pork tapeworm. Taenia saginata is the beef tapeworm. Eggs released in the feces from the host, potentially us. Those eggs get ingested by livestock, which in turn hatch out and then form a cyst within the musculature. As we eat poorly cooked meat, we set the stage to contract one of these worms, and dependent upon their respective parasite sets the stage for one of these, all right? There is another one besides our beef and pork. Diphalobothrum latum is the broadfish tapeworm. So sushi sets the stage for contracting some of that similar sort of long tapeworm, same but different. These are some flukes. So flatworms like our tapeworms, but the tapeworms are cestodes and these guys we call trematodes. So both tapeworm and fluke are hermaphrodites. So they've got both sex organs. And in these, they're kind of leaf shaped. And we can see a lot of the reproductive structure within this liver fluke. This one is an intestinal fluke. And similar idea, but different areas within the body where they would be residing. So huge list of these guys, and I'm not going to bog you down with all of the details because I feel like we've hit the bulk of these things in the first place. Echinococcosis, we didn't talk about, Echinococcus granulosus. In this case, we would serve as an intermediary host. Dogs typically are the definitive host. They shed the eggs in their feces. We come in contact with that. And then we've got the potential to form pretty good sized cysts within our body. Some of them can be truly massive. and set the stage for a possible fatal infection. But oftentimes, pretty slow growing, could take decades before you truly see any ill effects and manifestations of those cysts. Kind of a crazy situation. So possibility for them all throughout the body. Surgical removal is a potential. There are some chemotherapies, albendazole and mebendazole. Lots of these types of drugs are good antifungal and antiparasitic treatments. But oftentimes it's surgical removal that we think about with it. So the liver flukes, oftentimes we think about getting infected with these guys by ingesting the fluke as it's encysted on the aquatic vegetation. So stuff like watercress and some other plants that may serve as a substrate for those parasites to take hold on, sets the stage to bring it to you. All right, I think that's all of them that I want to say with that. Strongyloidiasis we didn't talk about either. Larvae also, like the hookworm, penetrating through the skin. It's a little bit different as far as the situation with that, but another potential. All right. Stop my share. Let me see if I can. I don't think I needed to share this. All right. Got to remember what I'm doing here. Share the right thing with my home viewers. Okay. We will quickly just introduce the littlest bit of this. I've got just a couple of minutes and I want to maximize all of my time. You got to get your money's worth, right? So circulatory and lymphatic system infections, there are numerous things that we can think about. Every time I see this, the first thought, as I see the mosquito, not the guy over here, but the mosquito, my first thought's malaria. But that's not what we're talking about here, all right? But it could be, all right? There are numerous types of mosquitoes, and with that, they have potentials to transmit all sorts of different disease. The mosquito here, Aedes aegypti, does not transmit malaria, but it does have the potential to transmit a handful of other things, one of which is yellow fever. It is another infection that causes liver damage, but this is a viral hemorrhagic disease. So something that causes issues within the blood, hence the circulatory system where we're at. So hemorrhagic disease that causes some pretty severe liver damage and jaundice that we can see. It can be a fatal infection, kind of just depends on likely the individual with that, all right? So circulatory and lymphatic, we will see oftentimes running parallel to the circulatory system, and organisms potentially in one or the other, maybe both, maybe utilizing either of the circulatory or the lymphatics as a mechanism to transport them elsewhere. We may think of systemic infections. So something starting somewhere else in the body, making its way into the circulatory system and moving. It's got onto the interstate, now can get anywhere it wants to go, right? And we may see it progressing through. Lymphatics should be full of lots of white cells helping to combat infection, yet some parasites utilize this and survive and proliferate within that or within the cells that should be doing the destruction in the first place. So lots of possibilities. So as we look at this image, a little cross section here, we can see the blood moving into these capillaries, providing nutrients to the tissues and oxygen, and in turn removing wastes and returning that back to reoxygenate, as we see. Fluid can be moving through this, so the plasma moving out of our circulation, becoming part of the interstitial fluid, bringing with that lots of antibodies, immune potential to these tissues, and in turn, the lymphatics are like the drainage, sucking up that and returning it back in. So one-way flow with the lymphatics from our extremities back to the trunk, and then ultimately it comes back in near the heart and brings the liquid back in. It's not this, it's the same but different. The lymphatic fluid, as we are draining it away, we pick up that interstitial fluid, become part of the lymphatic fluid, dump it back in here, and now it's back to plasma. And we kind of just keep cycling it through and filtering as well, as we think about things like the spleen or lymph nodes that provide an opportunity for the fluid to get in there to slow, to give cells the opportunity to interact and to maybe recognize potential foreign invaders. I'm pretty sure one of the videos with the immunity stuff went through some details about like a lymph node and what's happening with those dendritic cells as they get up in there. Similar details. Here we can see an image with some endocarditis, metrial valve, and these bacterial vegetation, so growth within there as we're looking at that. Here's an image of gas gangrene. So we talked skin stuff the littlest bit with the Clostridium perfringens, and now we're back to this because there are definitely potentials as we think about septicemia and getting in and causing bigger concerns. So the gas gangrene, the pockets of gas as the result of the bacteria as it's in there growing, creating these gas pockets. It is anaerobic as they are going through here and proliferating. And so we get these pockets of gas causing the separation within there. That's what we're looking at. And necrotic tissue, although we're not all blackened at this point, the infection is definitely something very serious. We saw the necrotizing fasciitis that was really a streptococcus, but we could see it getting debrided, and something similar is likely going to happen here. And potential amputations may be common with that also. We'll talk about Francisella and we will stop. Francisella tularensis is a bacterium that is on the list of potential bioterrorism culprits. It is a serious pathogen. It is something that is very contagious, pretty easily transmissible. If we think about maybe a hospital situation, there are concerns. This individual doesn't look like it's that big of a deal, little wound on his hand. We call Francisella tularensis rabbit fever because rabbits oftentimes harbor this organism, and coming in contact with them may set the stage for infection. I will quit with that, and we will pick up with the last of this stuff Friday. Farewell.